I'd say the healthcare system is in some ways ready to take this on and in some ways not. Again, my focus is on community health centers. I think pediatrics, primary care, family medicine, in particular, those specialties or those areas of care, they understand, they know, right? They know that social determinants affect health. That's obvious to folks who are dealing with patients, especially again in primary care, family medicine, and pediatrics. So I think they're ready in that they understand this stuff affects our patients' health. I think the challenge is, you get folks who are trained to be clinical care providers are now being asked to also be, in some ways, social workers, in some ways, make referrals to community agencies. So then there are these staffing issues. Involved with, like, do you have to have a social worker on staff? Can you afford to have a social worker on staff? Like, are they going to be there all the time? How do you get those referrals? How do you get patients? How do you help support healthcare systems take that next step beyond just sort of knowing that a patient's needs are affecting their health, or maybe trying to address them in a non-systematic way to facilitating them helping with community referrals in a systematic way? That's I think it involves a certain amount of a cultural shift for healthcare staff, I think, to think about, now we're addressing that too, like now we got to take that on. But I do think that the folks in the medical system are ready in some levels and not in others, right? I mean, because of that cultural shift that's going to be involved with making that referral. And that's really, I think, again, a cultural issue around kind of acculturating healthcare providers to thinking like this is also something we need to take on.